Once a mom is pregnant, there are a lot of important things that need to be treated. She wants to have not only a good experience during the pregnancy, but of course the birthing itself should go as smooth as possible. And a big part of that has to do with the pituitary gland again, because the pituitary gland and the vagus nerve is involved with how the uterus works and the entire birthing process. One of the hormones that the mother creates during the birthing process is called relaxin. Relaxin enters the muscles, enters the ligaments and the connective tissue of the hips, and allows those hips to spread so that the baby can pass through more easily. So that's the bottom of the hips, right? If relaxin doesn't do its job, the hips cannot open. And if the hips cannot open, that baby's going to get stuck. If that baby gets stuck, the doctor has to pull the baby out. And not only is the baby's head going to be pressing against a hard surface, therefore causing cranial issues, as the doctor pulls that baby out, the doctor is going to cause cervical distortions and cranial distortions. And if you look at the body, the way that it's supposed to work is that as the bottom opens, the top closes, and that actually helps to push the baby through. All that mobility in the hips and the joints of the hips comes from something called relaxin. So if the mother's cranium is not right, the vagus nerve is not right, in other words, there's pressure on the vagus nerve because of tight muscles around the neck, then that's not going to work correctly. So the hips are not going to be as flexible. It's going to make a much more difficult birth. Another part, if I show you the back of the hip, from these 2 points in the hip, there are some very, very thick ligaments that if relaxin doesn't get to those ligaments, it closes the space. So not only do we work, of course, on the cranium and C1, C2 in the back to help with that, we actually work on those specific structures like the piriformis muscle, the deep hip rotators, as well as the ligament that's there that holds these bones together. We soften those tissues, increase blood circulation, so when it's time to give birth, relaxin can get to those structures and actually allow the hip to open as the baby is being born.